7. The most common route by which infection may reach the pulp is through A. The bloodstream, B. Traumatic injuries, C. Dental caries, D. Erosion, E. Periosteum. Option C is correct. Explanation: dental caries is the infection in which zoonotic strain of bacteria accumulate on the enamel surface where they elaborate acidic and proteolytic products that demineralization the surface and penetrate the enamel, dentine and pulp. 8. The cells responsible for root resorption are A. Fibroblasts, B. cementoblasts, C. osteoblasts, D. osteoclasts, E. odontoblast. Option D is correct. Explanation: osteoclasts are multinucleated cells that help in resorption of calcified tissue like bone and root of tooth. 9. Dry socket is a form of A. osteomyelitis, B. osteitis, C. osteoma, D. periostitis, E. granuloma. Option D is correct. Explanation: dry socket is a painful condition that happens after tooth extraction. It is due to the blood clot at the site of the tooth extraction fails to develop, or it dislodges or dissolves before the wound has healed. 10. Inflammation of the lips is referred to as A. stomatitis, B. glossitis migricans, C. chylitis, D. Vincent angina, E. siladenitis. Option C is correct. Explanation: chylitis glandularis is the enlargement of lower lip caused by chronic inflammation of minor salivary glands and distension of excretory ductile structure. 11. Dents and dentae occurs most commonly in the A. maxillary canines, B. mandibular premolars, C. mandibular second molars, D. maxillary lateral incisors, E. all incisors. Option D is correct. Explanation: dens in dentae, also termed dens invaginatus, is developmental abnormality that primarily affect the permanent maxillary lateral incisor, characterized by deep enamel-lined pit that extends for varying depth into underlying dentine. 12. Paralysis of the tongue is referred to as A. ankyloglossia, B. glossoplegia, C. macroglossia, D. pyroglossia, E. geographic tongue. Option B is correct. Explanation: glossoplegia is the paralysis of tongue. Ankyloglossia means tongue tie. Macroglossia means large tongue. 13. An abnormal disease in the flow of saliva is called A. tealism, B. trismus, C. xerostomia, D. salivation, E. siladenitis. Option C is correct. Explanation: xerostomia is a disease in which flow of saliva reduced. Trismus is condition in which jaw muscle becomes so tight that you cannot open your mouth. 14. The cells most frequently found in a granuloma are A. mast cells, B. giant cells, C. lymphocytes, D. neutrophils, E. RBCs. It's option C. Explanation: granuloma are composed of epithelioid cells and gain cell nearby aggregation of extensive lymphocytes and plasma cell. 15. A cyst occurring under the tongue, caused by obstruction of a salivary gland duct, is called A. follicular cyst, B. dentigerous cyst, C. ranular, D. dermoid cyst, E. epidermoid cyst. It's C option. Explanation: a ranula is a fluid collection, or cyst, that forms in the mouth under the tongue. It is filled with saliva that has leaked out of a damaged